All right, thank you everybody for joining. My name is Ryan Peters. I am the agency president for Philam Insurance Agency based out of Houston, Texas, but licensed in 30 plus states. So if you're watching us, we are licensed in your state, and so I'm hoping that we can help you today understand Medicare a little more. On the top right hand corner of the presentation, you are going to see 25-26 with the projected numbers for 2026. We did update that this weekend as the new numbers have been released for 2026. And so the numbers that we're going to share with you today are accurate for 2026. So a little bit about us. What do? We own and operate an insurance agency, as mentioned, licensed in multiple states. And so our goal is to help you understand Medicare, what's available to you, the different types of Medicare. And then as we get into more of a personalized one-on-one discussion or small group sales discussion, we look at what specifically is going to be best for you based on your lifestyle and how you operate and what your goals are for the next year. One of the things that I tell my clients and my teams is that remember, healthcare and your Medicare plan is completely individualized and is personalized for you. It's not like it was 70 years ago and you worked for one company for 40 years, 50, 60 years, got a Rolex at the end of that. You need to do what is best for you. Today that might be carrier A, next year it might be carrier B. You have to figure out what is best for you, and that's what we help you with. As always, we don't charge you for our time. How we make money is when we submit a plan for you, then that carrier, United Healthcare, HealthSpring, etc., they pay us a commission based on what we submit. When it comes to commissions, there is a safety net, I'll call it, in place for you as a client that all plans can only pay a maximum amount. So we're not going to pick a plan that pays us more to sell you. We're going to make sure we put you on the best plan possible for you in your journey. I will caveat that by saying this year, many of the carriers put out plans that they're not paying commission for, okay? Whether that's fair or not, that's a different discussion, but I will tell you that there are plans that you may be looking at that we do not earn a commission. We will still tell you that that plan is available. We will also tell you that we're not going to make commission on that plan, and a lot of times we're unable to submit those plans as well, but we'll help you get to Medicare.gov, etc., to a place where you can, okay? We're 100% transparent and honest. We want to operate this business with trust and loyalty, just as you would any other of your friendships and or conversations that you expect to have, okay? So what do? We're going to help you understand what plans are available, what spam calls are, what's a deductible, what do you do next, what doctors can you go to, what's in network, out of network. We're going to walk you through the confusing paths of Medicare. If you've never been on Medicare before and you're just going to enroll in Medicare, we'll help you through that process. We'll show you what to do on ssa.gov, which is faster than a phone call 9 times out of 10. If you've been on Medicare for 5, 10, 15 years, however long, we'll do a review for you and make sure that you are on the best plan for you for the upcoming year. Okay? Let's move forward. So who do we help? As mentioned, those who are turning 65 going on Medicare for the first time, or maybe you've been on disability, maybe you're 35. You've been on disability for 24 months, then now you're eligible for Medicare. We'll help you pick out that plan as well. For those that are older than 65 and you're losing insurance coming off your group plan, we'll help you there. Those that are older and on Medicare already, as mentioned, will help you as well, okay? So the ABCs and D of Medicare. What is Medicare? Medicare is the U.S. government's largest health insurance program, serving more than 66 million people. What Medicare is? It's a federal health insurance program for U.S. citizens and legal residents. It is individual health insurance. It's not like when you were working and you had a group plan for your family. This is individualized for you. Medicare is not Medicaid. It's not Social Security. And as mentioned, it is not a family plan. So who can get Medicare? You can qualify for Medicare if you meet one of the following requirements. You're within 3 months of turning 65 or older, even if you still work. You're younger than 65 with a qualifying disability. You have end-stage renal disease, ESRD or ALS. These are different ways on how you can get Medicare. What does Original Medicare cover? Original Medicare consists of Part A and Part B. This is Original Medicare. This is not a Medicare Advantage plan or a Medicare Supplement plan. This is just Original Medicare, Parts A and B. So Part A, which is your hospital insurance, hospital rooms, meals, intensive care, skilled nursing care, operating room services, hospice, rehabilitation services, some healthcare services, some drugs and medical supplies for inpatient stays, so you're staying in the hospital. That's Part A. Think of that, Part A, hospital. Part B, think of physician and medical. Part B is your doctor visits, your annual wellness visits and preventative services, your outpatient care, mental health care, clinical lab services, durable medical equipment. You may also hear it be called DME, durable medical equipment. So that's like your walkers, your canes, etc. Ambulance services and occupational physical therapy. That is what is wrapped up into Part A and Part B. This is Original Medicare. This is what you're eligible for. As we mentioned before, when you turn 65, you have ESRD, you have ALS, or if you have a qualifying disability, typically at 24 months of being on disability, then you're eligible for the Medicare, okay? So that is what Original Medicare will cover. So in continuing Original Medicare, remember this is Original Medicare. This is not Medicare Supplement, it's not Medicare Advantage. This is just if you go with Original Medicare Part A and B. What does it cost? You're gonna find that it can be costly to just be on Original Medicare. So with A and B, there is no out-of-pocket maximum on Original Medicare. So what does that mean? That 20% charge that you're going to be assessed, it's going to be 20% of everything that comes in, okay? That is why additional coverages are recommended, okay? So when it comes to the premium, as long as you have worked 10 years or 40 quarters, your Part A premium is $0, okay? Now, if you have only worked 5 years as an American citizen and paying taxes, you can still get Part A, but you will have to pay a premium. So if you have worked 10 plus years throughout your lifetime, your premium will be $0. For 2026, the deductible that you will have to pay for your hospital insurance, Part A that we discussed earlier, is $1,736 per benefit period. Other costs is if you're in the hospital for more than 60 days, you will be charged $434 a day up until day 90. After day 90, you will be charged $868 per day, okay? There is a lifetime reserve that you can use. It's 60 days throughout your lifetime that you can use if you go into the hospital or if you're in the hospital for more than 90 days. Your Part B is going to be $202.90 per month, okay? Now this is going to be no matter what. Your Part B is $202.90 a month. That's going to be, even if you're on a Medicare Advantage plan or a Med Sup plan, Original Medicare, they're going to get their $202.90 a month. Now, there are some stipulations. Let's say you're a Medicare Medicaid. There are some programs that will help you pay for the Part B, but for most of your American citizens or most of your people that are on Medicare, you're going to pay $202.90 a month. Your deductible for Part B is $283 a year, okay? And then 20% of all other costs you'll be responsible for. So what does it cost? Original Medicare, you can see it can get quite expensive. Part B detailed costs by income bracket. If you remember on that last slide, we told you that your Part B premium is going to be $202.90 a month, right? Now, this is if you're within certain income brackets, okay? So you can look here, you have your individual. So if you file as individual or if you file as joint, they're going to be different income brackets based on what you earn. Now, this is going to pull from 2 years prior. So for 2026, it's going to be based off what you made in 2024, okay? So if you, as an individual, have made under $109,000 or $109,000 or less, your Part B premium is going to be $202.90. If you made between $109,000 and $137,000, your Part B premium is going to be $284.10. If you're filing joint, you're married filing joint, and that number is going to be $218,000 or less, it's $202.90. And then you can see how that works up from there. Now, one of the things that we do for you that maybe a lot of agents do not, or you may not be aware of, let's say in 2024 you had a property that you sold. So let's say you paid off your house, or your house has been paid off for years, you sold it and moved into something smaller. Well, let's say you're showing an income of $500,000 for that year because you sold your home. Well, based on 2024, if you made an income of $410,000 to $749,000 for the year, your Part B premium would show as $649.20. Now, you and I both know that you don't make $614,000 a year typically. It just happened that you sold this piece of property that increased your income for 2024. Now, there is a Social Security form that we can file and help you file that will bring this back to your original amount. All you do is prove what was the difference in what you really make versus what you made that year. Give the reason, fill out the form, and submit it. As long as you're under that $218,000 as a married joint income, you would go back to the $202.90. So very important to remember, if I have an abnormal income year based on some reason, make sure that I reach out and find what form I need to fill out so I can bring my Part B premium back into what is realistic for your lifestyle. Okay? So that's your Part B cost by income bracket broken up. All right, so we have talked about what's not covered by Medicare, original Medicare that is, remember just A and B. And now let's talk about getting more coverage and why it's important as you are going into the Medicare age, as you are hitting your 24th month of disability, and or you're already on original Medicare and you're saying, what's available to me? I really haven't looked into this yet. So let's take a look at those different options that you have when it comes to getting covered. Really, there's two different ways, okay? So we call it the number one, set it and forget it, or the number two, pay as you go. Think of it as set it and forget it, you're paying up front. And then number two, the pay as you go, is kind of like what you've been on most of your life, most likely, when it comes to a group plan. So if you've had an employer, you've had different payments as you go to the doctors, et cetera, et cetera. So these are the two different things we're going to look at. Number one, set it and forget it. You're going to have original Medicare, okay? That's going to cover your 80%. Remember what we talked about in that payment slide where 20% was your responsibility? So you're going to have original Medicare. And then this option here, you're going to add what we call a Medicare supplement, or you may hear it called a Medigap plan. This will cover that 20% that you're responsible for. And then on top of that, you're going to have to bolt in or add on like a Part D prescription plan. So Part D is your prescription drugs. You will have to add in a Part D prescription plan. If you do not add that in when you become Medicare eligible, later on when you do decide, hey, I need some prescriptions, you're going to be penalized for not signing up for this during that initial enrollment period. Okay, so number one, set it and forget it. Medicare supplement plan, you add that on. You're going to average cost of $160 to $200 starting out. And then it rises every year up to, I've seen about $400, $450 a month for the Medicare supplement plan. So number one, set it and forget it. We'll talk about that in a minute. And then number two is pay as you go. So this is original, enroll in an original Medicare. And then you're going to select a Medicare Advantage plan. So this is called a Part C. So Part C plan, what that does is it puts A and B, remember your hospital and your physicians, into one plan. And then most of your plans will have a Part D, the prescription drug coverage, included in that. Now, one caveat to that is going to be, let's say you're a veteran and you get all your prescriptions through the VA. right? They do have Part C Medicare Advantage plans that omit the prescription drug coverage because you get that through the VA. Those are called MA, Medicare Advantage only plans. The other option is an MAPD, Medicare Advantage with a prescription drug plan, or Part D, okay? These pay-as-you-go Medicare Advantage plans, Part C, also often will have additional benefits. And you've probably seen this. You've seen the commercials, food cards, transportation, dental, vision, hearing, all of these things. Those are bolted into the Part C plan, and you do not have to, most of the time, pay extra for those. So let's take a look at these two options. Number one, set it and forget it. So this is going to be your Medicare supplement plans, okay? You're going to pay an additional fee to your Part B premium, right? So your Part B premium just came out this weekend, $202.90, so $202.90 a month. You're going to pay that Part B premium no matter what, whether you're on a Medicare supplement with Original Medicare, whether you're on just Original Medicare, or if you take a Part C Medicare Advantage, you are going to still have that Part B premium. When you do choose to go the Original Medicare with a Medicare supplement plan, you will have an additional fee for that Medicare supplement. It is a premium that you're going to pay for that plan. This slide tells you it averages from $50 to $450. I'm going to tell you, if you're going to get a basic plan, Plan G is your basic plan that most people are purchasing, you're going to pay $160 to $450 depending on your age and so forth. If you're looking for a lower plan, which we'll talk about on the next slide, which is like a Plan N, yeah, you could pay $75 to $100 a month for that, okay? These plans, there's 10 of them. They're all have its own letter, standardized by the federal government. So one of the things I like about this is it's standardized. So it doesn't matter if we get this plan from HealthSpring or United Healthcare or Humana. The benefits are going to be the same. What you're paying for is the name, the customer service, the company, brand logo, right? So that's what you're paying for, because you'll see some differences. You'll see one Plan G at $155 a month. You'll see another Plan G at $190 a month. It's like buying sneakers. You can have Adidas, Nike, Starter, or the Walmart brand, right? That's kind of what you're paying for. There's no drug coverage in these plans. There's no dental, no hearing or vision benefits. You can add those as subsequent to your plan, but they are not included in your plan. There is no medical underwriting for these plans up to the first 6 months of enrolling in Part B at the age of 65 and older. What that means is you can go into the Medicare supplement plan. You have a chronic condition, you have heart issues, you had cancer, God forbid, and as long as you're enrolling in this plan within the first 6 months of getting your Part B, they're going to allow you into that plan with no medical underwriting. They're not going to check your health records. Now, after those 6 months, they're going to check your health records. So if you have some underlying conditions or some major challenges with your health and this is the route you want to go, make sure that you get into this plan within the first 6 months of having your Part B, because they will not check your health record. After those 6 months, you're going to have to go through underwriting to get approved for this plan, okay? So keep that in mind. Once you have it, it is guaranteed renewable as long as you're paying your premiums. There is coverage nationwide. As long as they accept Original Medicare, there's no network, okay? So that's one of the benefits of a Medicare supplement plan. Now that we looked at an overview of what a Medicare supplement plan is, let's look at your options that you're going to have. So I'm not going to go into all of these. We can do that on a one-on-one. I'm going to show you the two most popular plans when people are getting a Medicare supplement, what they typically will choose, okay? The first option is people will choose a Plan G or a Plan N, okay? So Plan G and Plan N are your typical plans that most people are choosing nowadays when they look into a Medicare supplement. So what is that going to cover? So let's say you have a Plan G, you're paying about $160 a month. That's going to rise every year. Remember, they will have percentage increases every year. It's going to cover here's the basic benefits it'll cover. Your hospital coinsurance, it's going to cover your hospice care, your medical coinsurance, your medical preventive care coinsurance, Part A and B blood, so if you need blood at a hospital or the physicians cover the first 3 pints of blood, right? And when you get into the additional benefits, it will cover the skilled nursing care, the Part A deductible. What it is not going to cover is that $283 Part B deductible. So you go to your doctor's office for your physical, not your checkup, just your physical. Let's say you have an actual full physical done. You're going to be responsible for that bill and any other bills, whether it be specialist, etc., medical-wise on the physician side, for the first $283. Once you're done with that, then everything's going to be covered as long as you're paying your premium. Okay? Now, when we get into the Plan N, what's going to happen here is you're going to have copays. So you'll have copays for every doctor's visit, every specialist visit, those types of things, but you're going to pay a lower premium. Okay? It also will not cover that first $283, so you'll be responsible for that. Those are the 2 most popular plans that I see people purchasing nowadays. All right? So that's Medicare Supplement. The benefit of Medicare Supplement is, and here's what I say, if you can afford this plan 5 years down the road, and this is what you want, go for it. If you're concerned about $160 today, and you're only going to have less money in 5-6 years when you really need the plan, really consider if that's the best option for you, okay? Because you're going to pay $160, $175, $200 a month for this plan for the, from 65 to 70 when you may not need it as much. Well, by the time you're 70, if it's $350 a month or $300 a month, can you still afford that plan? That's something you have to ask yourself. Can I really afford this when I'm 70 years old and I need it? Otherwise, it might be a good idea to take a look at a Medicare Advantage plan, which is a Part C, which we're going to look at now. Okay? So your Medicare Advantage or your Part C, you'll really rarely hear it called a Part C. You're going to hear Medicare Advantage. You're going to hear MAPD. Those are the things that you will hear. Now, every Medicare Advantage plan has to cover everything that A and B covers, okay? They have to cover it. It's a law, all right? Most plans are going to include a prescription drug coverage. Those that don't are going to be called an MA, Medicare Advantage only plan. So if you're a veteran, like I said earlier, if you're a veteran and you're getting your prescriptions through the VA, you probably want to look at an MA only plan, right? Many of your plans are also going to offer routine dental. Many of them offer comprehensive dental, eye exams, glasses, money towards those glasses, hearing tests at no cost, hearing aids for a low cost, various wellness programs. You'll see some that have transportation, some that have food benefits, some that have fitness memberships, so there's a lot of benefits built into these plans, okay? Now, the cost of a Part C or a Medicare Advantage plan is often, we're seeing those at 0 premium. So there's no additional cost for a lot of these plans outside of your Part B premium. Remember what I said earlier. Part B premium is something that you're not going to get away from unless you're on LIS or have extra help. Those types of things, Medicaid helped for those costs. But other than that, whether you go original Medicare with a Medicare Supplement plan, or Part C Medicare Advantage plan, you're still going to be responsible for your Part B premium of $202.90 in 2026. You may have out-of-pocket copays and coinsurances when you use services with a Medicare Advantage plan. And we can go through those one-on-one. You're going to see average of a specialist is going to be $20 to $40 per visit. Your PCP or your general care doctor is typically going to be 0, so there's no cost for that one. And then you'll typically have an out-of-pocket maximum, or what we call a MOOP, maximum out-of-pocket. You're typically used to this with your group plans as well. If you remember, growing up, I had a Cigna plan, right? Cigna group plan through my dad's insurance, or a Blue Cross Blue Shield through my dad's insurance, or my own insurance. When I saw that, we had a maximum out-of-pocket. A lot of them had high deductible plans of $5,000, $5,500. What you're going to like about many of these plans, they have 0 deductible on the medical. So the insurance kicks in right away. So it's not like what you're used to, man, we got to pay $5,500 out of pocket before the insurance even kicks in. That's not the case here, okay? Most of your plans, Actually, all that I've seen today, but when you watch this video, who knows what may change. Most of your plans are going to have a $0 medical deductible, meaning insurance kicks in right away. The other factors that you look at is they are networked, okay? So unlike the Medicare supplement plan, where anyone that accepts original Medicare you can go to and they're in network, with the Medicare Advantage plan, they have what they call HMOs, which are networked organizations. So you will have to make sure your doctor's in network, and we help you through that process to make it a lot easier for you. So that's Part C. Let's look at Part D, which is Medicare prescription drug coverage. These are private plans that help cover the cost of prescription drugs. They cover the most common medications, specific brand name and generic drugs according to the plan's formulary, which is also known as the drug list. Vaccines that are not covered under Part B would roll into the Part D as well. For this, remember, if you're on a Medicare Advantage plan, most plans will have a Part D or prescription drug coverage included, which is great. If you go the original Medicare route, you have to purchase a Part D or prescription drug coverage plan. These are separate, okay? So I don't want to get you confused. This would go with original Medicare and a Medicare supplement plan. So you would have to pay a premium for these. There is one, I believe there's still one that is zero premium, but you have to make sure that your prescriptions are covered and the cost of those prescriptions to make sure it's worth it. The average premium is going to be about $56 a month, okay? You will have a copay for each medication based on its tier. There's 4 to 5 tiers, typically 5, actually even now 6 tiers that you'll see, from lowest price being 1 to highest price being 5. If there's a tier 6, those are typically like your vitamin Bs and those types of things, okay? You may have a deductible of anywhere from $200 to $500, okay? And you may have to use a specific pharmacy network. We help you through that process, like I said earlier, to make sure that your prescriptions are covered, you have the lowest cost based on tiers where that drug lines up, as well as premium. So we plug in your prescriptions for you, and we hit a button and it pulls up all plans that are available for you based on cost for the year. So that's your Part D Medicare prescription drug coverage. Remember, if I can say anything without trying to confuse you, Part D separate prescription drug coverage goes with original Medicare and a Medicare supplement. Your Medicare Advantage plans will have a prescription drug coverage option available built in to the plan, so you don't need it separate. Now, detailed costs based on income brackets. Now, this is going to be filing status. So your Part D detailed income or cost by income bracket, it's similar to your Part B based on your income, whether it be individual or joint, based 2 years ago, so 2024, how much did you make in 2024? This is how it's going to roll out for your premium cost. If you earned more and you made $230,000 that year in 2024, if your plan premium was $0, you're going to have to pay an additional $1,450 a month on that premium based on your income level, okay? If you have questions on this, this is the route you want to go, reach out to us. We'll help you through that process, but you can see that there in the presentation, okay? When it comes to Part D coverage and stage, or coverage stage and formulary, here's how it works. In addition to your premium, you will pay an amount per prescription, which depends on your coverage stage and drug type, all right? So during the year, you may go through drug coverage stages, which impacts the amount paid per prescription. If you're in the deductible phase, so let's say you're in a Part D plan that has a $200 deductible on all tiers, right? Some of them, most of your prescription drug plans will have a deductible that is for tiers 3, 4, and 5, meaning your generics are not required to be under that deductible. Meaning if you have all tier 1 and tier 2 prescriptions, but your plan has a $200 deductible for 3, 4, and 5, you won't have to worry about that, okay? All you have to do is pay what is the coverage amount, okay? Now, let's say you did have a tier 4 and 5 prescription. Let's say Eliquis. Eliquis is not a tier 1 or tier 2. It is an expensive prescription. You would be responsible, if your plan had a deductible, to pay for that deductible amount before your initial coverage went into effect. So if you had a $200 deductible on your Part D and you take Eliquis, that first month you're going to pay $200. And then your initial coverage will come into play. Once you hit $2,100 in your total cost of prescriptions, then your cost share becomes zero. Then you won't have to pay a dime for the rest of the year as long as that prescription is in the formulary. This can be confusing. Like I said, we will sit with you one-on-one, whether it be in person, via Zoom, phone call, whatever you prefer. We'll look at your specific prescriptions, find out which plan is best for you that's going to save you the most money, and make sure that you're on the right path. So reach out to us if you have questions with this. Making that decision, you really want to take into consideration everything that I mentioned. Do you want option one, which is original Medicare, that covers 80%, and then bolt on the Medicare supplement plan with a monthly premium, right? But you're covered after that deductible, depending on the plan you choose. Make sure that you add a prescription drug coverage. If you want dental, we'll add the dental and vision as well. And so we'll work through that process. There's a lot of bolt-ons and add-ons to that plan that will work through you through that process. A benefit to that is as long as that doctor accepts original Medicare, you're good. There's no network. The other option is Medicare Advantage, Part C. Typically a $0 premium covers a lot of different things, right? You get the additional benefits, dental, vision, hearing. Some of them will have transportation, gym benefit, meal benefits, all those different aspects that you're available for at a $0 premium with co-pays, etc. Definitely something that you want to look at as well. So those are really your two options when it comes to Medicare. What do you consider? What do you look at? What's best for you? Listen, this is a personal decision. That's why when we sit down with you, we find out what's important to you. What's your lifestyle like? What's your health journey like? Where is your life right now in your health journey? And then we tailor the plan specific for you. Now, one of the things that I want to make sure that everybody understands is that this is not like it was when you worked for an employer and they gave you a group insurance. A group insurance is like an umbrella. It just covers your family. With Medicare, it's very individualized. We find many times a husband and a wife, they'll be on two different plans because their health journey, their goals and their lifestyle are completely different. And so we look at that and we make the recommendations based on what's best for each of them individually. Now, we'll sit down with both of you at the same time. We'll look at each other's options and see what's best for you. But I really want you to understand it's very personal, it's very individual. And so we'll look at that as we go through it. Additional considerations. There's different types of plans as well outside of what I discussed called special needs plans. So if you have a chronic condition, so heart condition, diabetes, if you're on Medicaid as well, there's specific plans for those that are on Medicare and Medicaid. Do you live in a nursing home? Do you need additional care? So those are some things where there's different plans available to you with different sets of benefits. There's also specific programs for financial assistance that we can help you with. Like I said, whether you're on Medicaid, there's Medicare savings programs to reduce your Part A and B costs. There's extra help to reduce medication costs. So we'll work through this with you depending on your income level and what you have available to you. We can help you through that process to see what's available and help you there. When it comes to enrolling in Medicare, when can you enroll? So the initial enrollment period technically starts 3 months before and after you turn 65. My recommendation, and I can help you through this process, our team can help you through this process. If you're not good online, we can do a Zoom call and we can walk you through on how to do this. I highly recommend you do it at ssa.gov. That's where you're going to start. Even if you don't want to start pulling out for Social Security payments, that is where you're going to go to enroll in Original Medicare, okay? Once you have that, then we can look at getting you into a Medicare Advantage or Medicare Supplement plan. So what you're going to do is, a lot of times you're going to be automatically enrolled into Part A, so you'll get your card in the mail automatically, but you will have to go online or call them. Highly recommend do it online and enroll into Part B, okay? You can delay your Part B if you're going to continue working, so you don't have to pay the $202.90 a month. So if you're going to continue working and be on employer insurance, that's okay. We'll just delay your Part B. You don't have to worry about that, okay? If you miss it, so let's say you miss that first 6 months, 3 months before, 3 months after, you can enroll during what we call the general election period, which happens between January and March for Parts A and B. Late enrollment penalties may be incurred, okay? So just remember, if you miss it, it's very important. If you miss it, you may have to pay late penalties, all right? We'll talk about that in a little bit. Enrolling in Medicare supplement plans. So for 6 months after you're 65 or older and enrolled in Part B, you can enroll into a Medicare supplement plan. No underwriting required. Remember that. For the first 6 months, no underwriting. They're not going to look at anything. They are guaranteed renewable as well. Okay? After 6 months of being 65 or older and enrolled in Part B, you can move to different plans. You just have to go through the medical underwriting. All right? So some things to think about and look at. Working past 65, we talked about this. You can delay without penalty if your employer has 20 or more employees. Okay? If they don't have 20 or more employees, you do have to go on Medicare, otherwise you will be penalized. Okay? So they would call that not creditable coverage if they have less than 20 employees. Now, what if I'm covered by my spouse's employer? You may be able to delay your employer-based health coverage if it's through your spouse. Okay? It depends on your spouse's employer and any rules the employer has around covered benefits. So we'll take a look into that more on the individual basis. Enrolling into Medicare after 65. So if you delayed enrollment, you can enroll the month after the last month of employment or health coverage. So, example, you worked for company A till you're 67. Let's say you worked till May 31st. You can set it up to where your Medicare will begin, your Part B will begin, your Medicare Advantage, your Medicare Supplemental Plan will begin June 1st. So we're able to do that. And you do have a certain amount of time that you have to do that without being penalized. Changing your plan, as mentioned, you can do this every year between October 15th and December 7th. It will go effective January 1st. And then they have the buyer's remorse period, what I call it. Let's say you go into a Medicare Advantage plan, you're not happy with it, it's not what you want. You have till March 31st of that year to switch plans as well, okay? There are various different special enrollment periods that you can utilize as well, whether there be a disaster in your area that stopped you from being able to enroll, you move out of the coverage area, those types of things. And like I said, a lot of this is on a one-on-one basis, but here's your basics, okay? So don't be late. Part A, if you are late for applying for Medicare, you could have a penalty if not qualified for the premium fee free. You could be penalized 10%. Part B, if you do not have employer creditable coverage and you're outside that window for enrolling in Part B, you could be penalized 10%, and then Part D is 1% for every month. So it can get costly if you're not careful and you're not enrolling on time. So my recommendation, if you're turning 65 in the next 6 months or so, give us a call, set up an appointment, we'll work through, we'll kind of get an idea what's going to be best for you, and we'll make sure that you're not late for those enrollments, okay? So here's some terminology that you may hear or see. I'll leave this up for a second. You can take a picture of that with your phone. But yeah, just some basic things that you're gonna hear throughout this process of going on Medicare. Well, I just wanted to thank you for your time today, guys. Again, my name is Ryan Peters. I am the agency president here. I hate the term, but it is what it is. We work with you to make sure you are on the best plan. I highly recommend that you hit the button that you see there, you schedule an appointment with us, give our office a call. Let's get you on the right plan that's best for your health journey to make sure that you're covered and not penalized. Thank you again. Ryan at PhilAm. I look forward to hearing from you soon. Bye-bye.